The Delphi survey method is a technique used to gather together and summarize the opinions of experts on a particular topic. Over multiple rounds of surveys, the questions are narrowed down until all the details are clear. Usually, we decide expert consensus has been reached when more than 75% of experts agree on the answer to a question. This approach is valuable when evidence is not yet available on important topics and to inform future research studies. This Delphi survey is exploring the opportunities and challenges of offering additional non-tuberculosis services to people with tuberculosis, TB, or their household members. Many people who develop TB and their family members also have other conditions like HIV, diabetes, malnutrition, chronic lung disease, mental health challenges, and financial difficulties. TB can also cause many of these issues. However, in most places, it is not common practice for people with TB to be offered screening and support for these additional non-TB services. This survey asks experts to answer questions including: should non-TB services be offered to people with TB? Should household members of people with TB be offered non-TB services? And what types of services should be offered? We are currently inviting you to participate in round 2 of the survey. In round 1, we received 223 responses from researchers, clinicians, affected community, policymakers, public health professionals, and more, from 44 countries across North and South America, Africa, Europe, and Asia. We found that 98% of experts agreed that TB patients should be offered additional non-TB services. 84% of experts agreed that these services should also be offered to household members. The top conditions for screening and services recommended for people with TB were HIV, diabetes, mental health, including depression, anxiety, stigma, and suicide ideation, and nutrition. The top 4 suggestions were the same for household contacts. However, other common suggestions in that group included hypertension and cardiovascular disease. Members of affected community, including TB survivors, listed mental health support 3 times more than other services. Round 1 gave us a detailed understanding of the priorities and considerations for integrated screening or services, and we will share more in due course. In round 2, our questions are narrower. We ask you to rate your agreement with the statement using a scale of strongly agree to strongly disagree, with very few free text questions. The focus is on the core principles to guide integrated screening, followed by questions relevant to your particular context. We expect the survey to be quicker than round 1, taking around 20 to 30 minutes to complete. There are comment boxes scattered through the survey if you would like to give more details or clarify any of your responses. The outcomes of this survey will help to inform TB service provision practices. Findings may also help to direct funding for TB programs and implementation research to determine if and how integrated TB care can be made effective and feasible to support TB-affected communities.